Welcome back. www.healthcmi.com. Acupuncture Continuing Education Online. Today, COVID-19 coronavirus, herbs found effective. If you look for the article with this title at healthcmi.com, you will find all of the information we're going to cover today and more. Simply click on News, and again, look for COVID-19 coronavirus herbs found effective. Let's take a look. Researchers conclude that Lianhua Qingwen capsules improve the recovery rate from COVID-19 symptoms. It also shortens the total time from initial symptoms to recovery and improves morphological recovery from chest radiologic abnormalities. In other words, less lung damage. Now, something that's not in this article, I want to go over very carefully. One herb is missing because this is the formula you can get in Italy. In fact, the pharmaceutical company, Yiling Pharmaceutical, that makes this high-grade herbal formula, sent it to Italy. 100,000 boxes, gave it to the nation of Italy. They wanted it. Gave it to Turkey, gave it to Iraq, gave it to a whole bunch of countries that wanted it because it works. It's used in Chinese hospitals. It is a Class A drug covered by the national healthcare system in China, supported by research. This is but one article. Anyway, one herb is missing because in the United States, we don't allow that herb in here, even though it's in safe low dosages. Because, yes, higher concentrations of any herb or food or drug can have adverse effects. And in this case, Ma Huang, it's not entirely banned, but let's say that it's difficult to import it. And yes, people do hyper-concentrate large quantities of this herb and make speedy-like drugs from it, or use it for energy boosters, which is highly inappropriate use of Ma Huang. The real use of Ma Huang is for the treatment of common cold and flu in small dosages. And that's exactly how it's used in Lianhua Qingwen, and that's why it's safe and effective. Now, to get it in the United States, they have just announced to me, they have made a special version where they took the Ma Huang out and added another herb, Feng, so that it's completely following the guidelines in the United States. Now, the concentrations of Ma Huang are hardly going to cause a problem in the original, but by a technicality, they needed to exclude it for the United States. So that could affect the efficaciousness to some degree of the U.S. versions of it that you can get. All right, so that's not in the article. And also what's not in the article is that many herbs, there are 6 major herbs that I know of already, many herbal pills, patent medicines, that are Class A drugs in China used to fight COVID, and standard procedure in Chinese hospitals is to use them. Along with oxygen therapy, along with some type of antivirals or antibiotics or whatever people need, they also get the herbal medicine. But there is almost a blackout entirely on this knowledge and the research that went into it. Remember that another strain of corona, the SARS 2003 outbreak of coronavirus, was in 2003, and the Chinese had a lot of time to figure out ways to battle this strain. If you think of the 2 major strains of viruses that affect humans during common cold and flu season in particular, would be influenza and also coronavirus. In this case, a particularly toxic and highly contagious version, COVID-19, is affecting everybody. So Lianhua Qingwen, there's a lot of research into this particular capsule. It's a great formula. It also contains a Tibetan medicine. We'll get into that in a little bit. Very interesting stuff. The research is from a multi-center randomized clinical trial indicating that Lianhua Qingwen capsules are both safe and effective for use in patients with COVID-19. The researchers add that an extended study is needed to thoroughly explore the effects of Lianhua Qingwen capsules on viral shedding. Now, the details are as follows. First, let me again reiterate, 92% of all COVID-19 patients in China receive Chinese medicine, and the medicines they receive are supported by studies. So, again, a Class A drug in China. So this study was divided into two arms. One group received usual care and another received usual care, plus Lianhua Qingwen capsules, 4 pills 3 times a day, for a total of 14 days. Now, usual care, might call that conventional medicine or hospital medicine, but usual care is a term that we kick around a lot in research. Out of a total of 284 patients in this study, 142 in each group, the group receiving Lianhua Qingwen capsules had a greater recovery rate, 91.5%, over the group receiving only usual care, 82.4%. The median time to symptomatic recovery was 7 days in the Lianhua Qingwen capsules group, and it was 10 days longer in the usual care group, so it took a lot longer to recover. And these stats go on and on and on for symptom recovery rates. Fever reduction was in 2 days instead of 3 days when you use the herbs. Fatigue dissipated after 3 days instead of 6 days because you used the herbs. Coughing abated in 7 days as opposed to 10 days. And most importantly, chest CT scans or computed tomographic improvements were significantly greater in the Lianhua Qingwen capsules, 83.8% better, as opposed to usual care only 64.1% better. In other words, avoiding long-term lung damage when you use these herbs. They're very simple, they're very safe, time-tested. They've been used for influenza and other outbreaks, sore throats, for many, many years. This is a very high-grade, pharmaceutical-grade herbal factory that makes this. In addition, the total clinical recovery rate was better in the Lianhua Qingwen capsule group, 78.9% versus 66.2%. There's actually a lot more details into the basic science behind it as well that they quote from other research showing that these capsules suppress the cytopathic effects of the SARS-CoV-2 in vitro and reduce viral loads in cytoplasm and cellular membranes, and so on. There's a lot more than just that. In fact, the inflammatory cytokine storm is one of the dangers of COVID-19, and Lianhua Qingwen capsules were found effective in downregulating inflammatory mediators, including TNF-alpha, IL-6, macrophage, chemokine protein 1, and several other factors. Now, when we take a deeper look inside this herbal formula, this is when it gets interesting. A lot of it's what one would expect. Jinyanhua, Lian Chao. You might know Lian Chao by Forsythia. Jinyanhua, it's a type of honeysuckle. And Hoshang, it's a type of patchouli. And Da Huang. But Hong Jing Tian. Now there's a lot of excitement over this, just like there's a lot of excitement over ginseng, for example. But Hong Jing Tian mostly grows at super high altitudes, and this herb gives a lot of energy to people. It was discovered Tibetan monks were using this. They had a lot of energy, and it's valued for improving concentration, physical endurance, memory, and absorbing oxygen. And it's highly regarded for its ability to abate altitude sickness, reduce stress, and benefit the Shen, or the spirit, as we say. Many varieties also grow in other areas outside of Tibet, but the Tibetan ones are the ones that became famous, at least first. It's a clear heat and toxin category herb. It's cold, sweet, bitter, and astringent. Enters the heart, liver, kidney, lung, and spleen channels, but it has several important functions. It tonifies the spleen qi, and if you can think of it, if you're not an acupuncturist, you can think of it as giving you a little bit of energy, just like extracting nutrients from food would give you energy. And clears the lung heat. So lung heat you would think of that as respiratory inflammation if you translate into kind of an English pattern. Nourishes lung yin. In other words, if the lungs become dry with dry cough, it can stop dry coughing. And it's useful for treating coughing due to lung heat, again, due to the inflammation in the lung, including bleeding. In TCM clinics, it's used for treatment of weakness after illness. Again, it gives you that energy, that boost. It can even treat vomiting with blood, or bronchitis and coughing due to pneumonia. So it's an adaptogen. It's valued for its ability to restore vital energy. And also Hong Jing Tian has some other functions. It invigorates blood and transforms stasis, and it's used for burns and traumatic injuries topically. And it can even treat things like leukorrhea. So kind of interesting they put that in there, because the exhaustion, the fatigue that goes along with many, many cases of COVID-19 is extreme. So it's really a good one to have in there. And there is a history of that in Chinese medicine where certain clear heat and toxin formulas do have a little renshen or ginseng in it for cases where people really need that extra boost. Like instead of Jingfang Baidusan, you have Renshen Baidusan, right? So you have those two formulas. Jingfang Baidusan has Jingjie, things like that, but it doesn't have the ginseng. But another version of it has ginseng in it, the Renshen, and that is because at a certain stage of a flu or illness, someone will have such exhaustion that becomes a problem in and of itself in the recovery. In this case, very clever for these people to put this in here because it's not only an energizer and tonic herb, it also clears toxins from the body. So this herb does two things at once. So just a very smart formula. Is it a panacea? Is it a cure for everything? No. But if you were only getting treated with usual care and didn't have the benefit of something like this, then you weren't really getting the best of care because this could tremendously shorten recovery time, improve overall symptoms as well. We'd like to see more research into this. There have been several other research articles that have already come out. If you go to healthcmi.com and click on news, we actually reference those at the end of the article, so you can look it all up. Again, we do translate many things that we're referencing here from the Chinese, but some of this is actually available in English, which is great. And we also support continued research at HealthCMI, so it's something we're very involved in. I hope you liked today's podcast. It's very important. This can help to save lives. Now, one of the secrets behind it saving lives is what? Administering the herbs quickly, we can prevent the symptoms from deepening into a severe pneumonia and eventually sepsis and death. So the key here is to prevent the COVID-19 from becoming more and more severe. So that's one of the key factors here of using an herb like this. It's so simple to disseminate. It's very safe. It's very effective. Now there's a version that can be used in the U.S. that's following U.S. laws until we fix them to account for this issue with Ma Huang. Because again, it's dosage dependent. How much you use something determines how safe it is. One of the problems in the U.S. is actually the laws themselves. You have your food laws, your FDA, USDA regulations on food. Then you have supplements, laws for supplements. And finally, you have drugs. And they're all regulated differently. Foods, supplements, and drugs. But there isn't another class of herbal medicines that are strong enough to be either prescription or maybe behind the counter at a drugstore. So this category is missing in terms of regulation and protection for the consumer. And on one end, so they don't wind up using an herb that's too strong. On the other end, protection for the consumer that they can have access to the herbs that will get them better. Too many herbs are unavailable like Shi Shin that consumers could benefit from that maybe they shouldn't use on their own, but could use someone like a licensed acupuncturist to give it to them appropriately. So while that's missing in U.S. law, unfortunately, it's also not protocolized into the hospital system where this is standard medicine. This formula is basically harmless. And the high safety level of this herbs and the research that shows that it's effective suggests that it should just be part of standard medicine. Yet, if someone is hospitalized, they're not going to get these benefits. This is a problem. People will suffer unnecessarily and people will die unnecessarily because they're not getting the true care they need. So this is something to think about moving forward and something that the Healthcare Medicine Institute works towards changing. And if you want to learn more, you can also contact us. Go to healthcmi.com, click the Contact Us button after clicking on Support if you would like to contribute to research and be a part of the solution. And also, if you like this podcast, please give us a like or write something up. We'd love to hear from you. Thank you for listening. I'm Adam White, licensed acupuncturist, www.healthcmi.com.